for speaking with APHA's Public Health Newswire. I know that this is one of our penultimate America's Health rankings, one of the better ones in years, and really wanted to get your opinions on what to make of these rankings. America's Health rankings for I think 24 years now has given us state by state insights into really how healthy America really is. And I know that there are some encouraging results this year, and figured you would be one of the best people to talk about it. But before we get to the rankings, I wanted to ask you a question about a comment you made at our 2012 annual meeting in San Francisco, where you talked about blowing up artificial silos between public health and medical health, which is interesting because you not only have a medical and clinical background at United Health, but also a strong public health background. So why do you think it's important to, for improving the health of our nation, to blow up these silos, and how did the rankings show that we're making progress in this area?
This is a very important issue because, as you at APHA are so well aware, the conversation in America about health is overwhelmingly a conversation about insurance and medical care. What we understand so completely by the data from America's Health Rankings, and we can't thank APHA enough for being a co-sponsor of this activity with United Health Foundation, is that the tsunami of preventable chronic illness that's washing over the medical care system is absolutely unsustainable. There's no way that we can medicalize our way out of this problem. We couldn't afford it, to be blunt, and there certainly aren't enough healthcare assets to manage this increasing number of people that are presenting with chronic illness, living longer and living sicker. And so we've got to find a way to stitch together the prevention side with the medical care side so that medical care can be more a part of an effective team at prevention. And that's really what I think is so important. The other reason why I think this conversation of blowing up these silos is that if we, not only do we have to have everyone working together around this principle of prevention, but what we also know that if we're going to find the resources for public health, those resources will only occur, I think, if we are able to show the value of public health in not only keeping people healthier, but preventing the downstream economic consequences that are associated with preventable chronic illness. And so as the delivery system becomes more accountable for the outcomes of care, if we can connect then the competencies of public health in an integrated way with the medical care system, it provides a much greater currency and relevance to what public health does. And I think it ought to be able to then cause and convince governors and other fiduciary responsible entities to invest in public health because of the return on investment that it will give in this new era of accountabilities for not only quality outcome, but cost effectiveness in outcome. So it's time to blow up the silos. We need everybody working together. But above all, we have got to focus everybody on turning off the spigot of preventable chronic illness and not just focus on how we're going to manage sick people with ever increasingly costly medical care.
And I think it's undebatable as to public health's ROI, or return on investment. And I think one of the great takeaways from America's health rankings is the fact that we do have an idea, and we do have numerical value for public health funding for all 50 states. I think that's really an amazing tool for folks to look at and to see how that affects the health of their state and our nation. But to get to one of the two takeaways from this year's report that I found fascinating and really I think highlight the rankings in general are that U.S. obesity rates are declining, For the first time, this has happened since 1998, and more adults are physically active. So how would you explain these shifts?
Well, I would put it in this sense that we are seeing through three key indicators, and you mentioned two of them, that there is a sense that maybe now all of the pieces of the puzzle are starting to recognize their responsibilities and are acting on it. And so what I see is the tobacco rate having gone from 21.2% now down to 19.6% as being obviously hugely encouraging and significant in its own right. Number two, that as you indicate, the couch potato rate, the percentage of people who are physically inactive has gone from 26.2% of the population to 23%. And then thirdly, finally, after year-over-year increases in obesity, we are now seeing a leveling off, so that we in fact did not go up for the first time, and it's leveled off at 27.6%. So what we think that means is that individuals are obviously in increasing numbers starting to make the decision to enact personally appropriate, healthy lifestyles, behaviors, and choices. What it also means, I think, is that communities are starting to become more effective at creating a culture of health, at being able to create nurturing environments for appropriate individual decision making and behaviors. And third, what it, I think, starts to mean is that we're getting leadership at our elected and public official level who are beginning to engage there. And then finally, I think what it means is we may be starting to get better emphasis through the medical care side on prevention. It is a glimmer of hope, and I think it is an encouragement upon which to build, as opposed to in past years where we've had to sound the alarm of the dire consequences and to let people understand the legitimate fear. Now, perhaps this year, we're able to have a conversation that builds upon momentum, which is a different kind of way of engaging people. But having said all of that, let's make no mistake. We cannot take our foot off the gas. We have got to move faster and with more urgency. This is not a time to rest on 1 year of trend data. We've got to work our tails off across the board to make this a sustainable movement.
Mm-hmm. And I think that really leads into my next question, is in keeping our foot on the gas, because even in light of these mostly positive findings, these rankings are first and foremost a call to action for individuals, communities, policymakers. So with these rankings, I want to ask you two things. First off, where does our nation's health need the most improvement? In other words, what's really the rallying cry for health advocates after seeing these rankings and seeing so many positive results? And then how important is it for partners like APHA to disseminate this information and this data, and how will that help change health outcomes?
I think the real key is where you ended your question. We must have data-driven community conversations. If there's anything that we have learned from America's Health Rankings, is that it is actually possible to have a conversation with America on epidemiology. As we are releasing this year's report, we have been able to have dialogue with almost every state in this country about this report and what it means. We are having a conversation with the nation on epidemiology. What that has to lead to is this data has to drive a community strategic planning effort that focuses on the priorities where people are. And those priorities will be different community by community, state by state. But we need to drive conversations that identify priorities and then mobilize resources in those communities to attack those priorities. This is what APHA, I think, is uniquely able to take forward. As you correctly indicate in your question, this report is all about a call to action. I think that's really where the key is. The other thing that I would indicate, though, in addition to our enjoying the collaboration with APHA, and by the way, all praise is due to America's public health professionals. They get so little recognition. And so from from America's Health Rankings, just listen to the applause that we're giving you for what you do every day in this country. We also enjoy a good partnership with ASTO. And one of the things that ASTO is doing with us, and I would think that with the leadership of Georges Benjamin and others, we will make sure that this is that our ASTO work will be shared broadly with APHA, is creating a learning laboratory where we are identifying which states have made the most progress in key areas, and then how did they do it, so that we create this constant learning feedback loop that identifies best practices and shares them in a continuous way with others. We're very excited by this, and I think that we all need to absolutely ground our public health practice in science and evidence of what works and what works best and most effectively.
Yeah, and I think mobilization is absolutely critical, and may explain some of the positive results we did see over the past year. I know that even with the Affordable Care Act, we're seeing it more and more the kind of collaboration between public health and medical health, and this is an important year in the Affordable Care Act as federal and state marketplaces have opened on October 1st and under tremendous scrutiny. And while data shows that marketplaces will help 25 million uninsured Americans gain health coverage, the results thus far have been mixed. Some have been good. Some there are certainly questions that remain unanswered. So in light of everything that's happened thus far in the Affordable Care Act timeline, how do you feel that the marketplaces, federal and state, will impact our nation's overall health moving forward?
Well, one of the things that the report recognizes and uses as an explicit measure is the rate of uninsurance. And so we clearly understand, and all of the public health scholars who create the measures for America's Health Rankings, by the way, they are nominated by APHA and Partnership for Prevention, and they're under the editorial leadership of the University of North Carolina School of Public Health at Chapel Hill. But one of those measures that is explicitly recognized by them, of course, is the rate of uninsurance. Having said that, and I do appreciate your question, but the thing that we really want to make sure that we're emphasizing is that, there's just so much conversation about medical care, insurance related to medical care. And what we've got to help people to understand is that what's really important and just gets so little attention in all of the plethora of news coverage about, the exchanges and the Affordable Care Act is what's not getting covered is the absolute imperative, much more so than the insurance side, is the prevention side. And so we have really want to focus on that, how individual states will manage the process of providing access to insurance is a state-by-state issue, and the report is neutral and agnostic on the techniques and the strategies that states will use to get that done. The only thing that we are emphasizing is important to have insurance for everybody. The states will figure out the best ways for them to accomplish that.
Mm-hmm. And I think an old statistic kind of pays homage to what you just said, in that 75% of our healthcare dollars at one point were used for treating preventable diseases, and yet formerly 3% of our healthcare dollars went to prevention. Can you speak to the numbers and if that's changing?
Well, just imagine.
Danielle and Dr. Tuckson, I'm so sorry. This is Joy here. We have another interview coming up that we have to wrap on, so this would need to be the last answer question.
So
Absolutely.
What's important is, just imagine, there are two freight trains moving at rapid speed directly into each other. One is this increasing tsunami of preventable chronic illness running head on into a medical care system that is increasingly unaffordable for Americans. This is a catastrophe. And clearly that no matter what we solve in terms of the access to insurance issue, it will be compromised because the cost of sustaining it with the management of this preventable chronic illness burden simply is incompatible. We have got to address the prevention side or we will be seriously imperiled. And I really appreciate APHA's leadership and involvement in this project.
Well, we appreciate everything that you've done and everything that went into the making of this report. So thank you so much, Dr. Tuckson.
Okay, man.
And we appreciate you speaking with APHA.
Take care, and thanks to everybody out there in the public health professionals. We love you.
Take care.